I now call upon our guest of honor, Shri N. Nawin Sona, Secretary, Public Health Department, Government of Maharashtra, for his address titled, India's Growing Vision Towards Digital Health. Ladies and gentlemen, kindly put your hands together for Shri N. Nawin Sona. Welcome, sir.
Thank you. Good morning, everyone. So, first of all, I would like to place my thanks to the organizers for having me over. And digital health is a very timely and critical topic, and I'm quite happy to be part of this event. Without taking much time for a build-up, we all know that the digital health has really taken off and become mainstream as we proceeded through the pandemic, and it is not an option anymore. We have seen how simple things like the CoWIN app is a layer which is almost taken for granted, and so many billions of users have come online and seen the results of such simple things as an app. But what we have in front of us is something much larger footprint, and I'd like to just take a few minutes to lay out this huge roadmap that the government of India and the state government, including government of Maharashtra, is now having the vision for. Now, most of us should have heard of the Ayushman Bharat digital mission. But what exactly it is, I would like to state briefly. I look after that implementation as far as Maharashtra is concerned. Now, the Ayushman Bharat has many focal points. One of them is, of course, the grand vision of the Honorable Prime Minister, which is to convert healthcare into a preventive healthcare mode. Not just wait for people to fall sick and take care of them, but convert this into more of a wellness paradigm. So all our public, the cutting edge, the sub centers, the primary healthcare are now focusing on preventive health. The work is already there. That is now integrated into the secondary and tertiary in a referral mode. Now this is again digital. Now what we are in government, this is not probably publicized enough, but there's immense connectivity, and every cutting edge and the rural areas are going to be connected with telemedicine. So we are going to have a seamless kind of a referral mechanism, and having a wellness concept. Now, the second aspect of the digital health mission is a huge footprint. What we are looking at is not just a platform. We are not just looking at a single an app, but this is where forums like this are very important, because now what the government has envisaged is an open set of protocols. Now all of us use the internet. We are able to communicate. How did the internet convert from the internet to the World Wide Web? That is because of the TCP/IP protocol. We are able to click on any website and browse. So those are interoperable links based on an open protocol. So I have an IT background. I'm an IAS officer. But I have a background in big data and Internet of Things. So I find myself in this medical space, but basically I'm an engineer, but I understand the tech behind the vision. Now, what these set of protocols, the digital health mission is unveiling as we speak, is to bring a full ecosystem into play. Now let me explain. The simplest way is to look at it as, first, you're going to have a digital, a universal health ID for all the citizens, which we call ABA, the Ayushman Bharat Health Account. Now, to all the luminaries in this hall and people watching online, this is something we are going to hear about a lot. Let us look at ABA as the Aadhaar of digital health in India, and in the next 5 years, 10 years, every single person is going to be having an ABA, which is a health ID. It also comes with a health address, something like a UPI. Now, what is the advantage of this one aspect? So you've got a portable number which can talk to public and private systems with a single number. Your own ABA number as a patient is portable across. The vision is to make it portable across all systems, be it pharmacies, testing laboratories, hospitals. Even an individual medical practitioner could start tagging your medical record on this ABA number. Now, this takes us to the concept of the electronic health record, the EHR concept, which is inbuilt into this. So, it's going to take probably 5 minutes to create a ABA number. You need a Aadhaar card online. It's free of cost. Once you do that, you can start uploading, as a patient, you can start uploading your own health records, and you have a consent framework. Next, we come to a consent framework with full privacy control, with full security in it. What the digital health mission is that you are the owner, as a patient, are the owner of your own health record. You choose whom to share it with, what level you want to share it with. There will be protocols to ensure nobody is tampering with it, and you can even access, you can even see the history of your access. So this is the electronic health record part of it. The third aspect is registering the ecosystem itself. Now what is that? Now one is the health practitioners, doctors, paramedics, could be therapists. Then there are institutions to be registered on this network. There are hospitals, pharmacies, you name it, the entire gamut, including insurance, TPAs, insurance companies. So every institution is going to have a unique ID. And that is going to be validated by government machinery. And once it's on the network, it is a secure system where there is no fly-by-night operators, and the health practitioners are identified based on their medical council registrations. The health facilities are actually verified on the field by government machinery. And once this network is there, then the layer starts building. So we are in stage one of this whole vision. Now, what is the next step? The next step is to have the digital means to achieve affordable, timely, accessible healthcare to all the citizens. Now, how is this going to be possible? Now we are opening up this whole system right into the open market. You know, each hospital could come up with multiple applications which will ride on this technical layer. Any clinical services could come up, and they will be more discoverable. Suppose the patient wants to find a doctor in the next, for teleconsultation in the next, let's say, half an hour. This platform would probably allow the discovery of suitable doctors based on affordability. Maybe I cannot pay 2,000 rupees for that online consultation. My limit is, let us say, 200. then this vision says you will be able to get a primary access instantaneously. Probably you will get a waiting time, you will get a, and your records will be digitally transmitted to that particular medical practitioner or to the hospital in real time basis. So apart from this, we are looking at public-private movement of health information. So what we would as a government reach out to all the private healthcare. There's so many of the CEOs and CIOs of major hospitals here. We would like to build this bridge between the private and public health information systems. There are HMIS systems, and I am not very sure. There are international standards like FHIR, FHIR standards, which government is now promoting and giving flexibility to modify to Indian usage. So if you take if you're not familiar with the FHIR standards, what they call FHIR, it's a bunch of protocols which lets you design every data point in your hospital. The patient data, the clinical data, the descriptions, the test results. Now the vision is to have this information seamlessly travel from public to private, probably on a cloud platform, so you will be able to access in case of a referral, in case of a discharge from let's say from a public to a private or vice versa. There should be instantaneous transmission of information. In an emergency case, I think that could save a life or two. So these are standards which government is promoting, and we are also looking at the next step. The next step is actually we are sitting on a gold mine of information and health data which we are not analyzing. I'm sure a lot of the hospitals do have a research wing. So can this information which is passing through your system, passing through the TPAs, passing through the insurance agencies, be collated and analyzed for better clinical performance, for analyzing public health? Now there are international trends in big data analytics where if the person doesn't give full consent to share the information, it is made anonymous. The personal information is removed and the raw data travels without the identity of the person for research purposes. So this is again a vision of the government to build repositories and depositories of health data which could be in fact mined. And for example, in the US we have rare diseases being discovered by sheer pattern recognition and data analysis. Now we are also looking at the insurance model. I also run the Prime Minister's Arogya Yojana, which is the insurance-based model. We in fact have 1,000 hospitals on both private and public space, in which the poorest of the poor get cashless, seamless healthcare. So this is another aspect of financing the healthcare. Government is actively going on the insurance mode, and this is a very exciting space. I would again take the time to insist and request all the participants in this event to have a counter in your hospital to start plugging in the ABHA number, the Ayushman Bharat health account number. I would, retrofitting this information later would be a huge cost. So let us all build this ecosystem together. And if your systems are getting streamlined into this whole ecosystem from day one, I think there will be much more buy-in from all the aspects of healthcare. I mean, there's a lot of IT learning to be done with the medical professionals, the doctors, and we would like to also look at machine-readable information. That is the next future where we are not just scanning, PDFs or having medical records being just photographed and uploaded. Is it machine readable? Can your computer actually read the clinical data? So there are formats like JSON and XML and so on. So this is the next round where the real digital information is machine readable and open, and that would create a huge change in the way things work. It would be faster and more affordable. Affordable how? Because you would be able to make better clinical decisions, which would save lives, save institutional costs, save transaction costs to the patient, and would give the confidence that there is nothing secret about my own health information. I am the owner of the information and I am free to share it and reap the benefits of sharing that valuable information. And the last point is again Internet of Things. Now the sheer number of medical devices which are going to go on the net is exponential. So why machine readable information is critical is because most of your devices are going to give out a lot of data. It could be your Fitbit or your smartwatch or home healthcare devices are going to give a stream of information which, if you don't analyze, is not going to help you much in a clinical side. So this is the very broad vision the Honorable Prime Minister has laid out in the last 4 years, and the Niti Aayog and the Digital Health Mission has taken it forward, and with the state government, our Honorable Chief Minister and our Honorable Deputy Chief Minister and our Health Minister are very keen on the digital health. On behalf of Government of Maharashtra, we would definitely look forward to interacting with the community in the coming days. I once again thank the organizers for having me over, and I wish the participants great learning, and there's a lot to learn and there's a lot to do. Wish you all the best. Thank you so much.